Hello, this is Group 4, and this is an MHealth intervention to improve continuous positive airway pressure therapy adherence in people with sleep apnea.
Hello, this is our outline slide. We're going to give you an overview. Then we're going to talk about understanding the problems of obstructive sleep apnea, CPAP use, and sleep quality. After that, we'll talk about our MHealth application objective. Then after that, we'll talk about our target audience, which are individuals with obstructive sleep apnea with CPAP use. After that, we'll go into detail about our MHealth application, which is SuyaSuya. And then we'll talk about usability, study design, and outcomes. And finally, we'll talk about in our discussion page about the issues and implications.
The medical problem is obstructive sleep apnea, or OSA. It's one of the most common respiratory sleep disorders, which affects approximately 15 to 30% in males and 10 to 15% of females in North America. Globally, there are about 936 million people worldwide with mild to severe OSA, and 425 million people worldwide with moderate to severe OSA. OSA is a disorder that presents as recurrent bouts of partial and total airway blockages during sleep, which cause periods of apnea, or temporary stop in breathing, and hypopneas, which are periods of shallow breathing. The apnea-hypopnea index, or AHI, is the mean number of apneas and hypopneas per hour of sleep. It's used to diagnose and determine the severity of the OSA. OSA is diagnosed when the AHI is at least 5 and is accompanied by daytime sleepiness. Some symptoms of OSA are snoring, excessive sleepiness, morning headache, concentration and attention deficits, memory problems, and mood changes. OSA can also lead to a number of different complications such as daytime sleepiness, increased risk of heart disease and hypertension, increased risk of type 2 diabetes, and increased risk of liver problems. Other complications are family member sleep disturbances because of the snoring. These symptoms and complications reduce the quality of life for those diagnosed with OSA.
CPAP machines are used to assist with controlling episodes of apnea, apneas and hypopneas, utilizing continuous positive airway pressure, also known as CPAP. Therapy is the most effective for those who suffer from obstructive sleep apnea. It was one of the biggest advances in history of sleep medicine after the discovery of sleep apnea in 1965. CPAP was invented in around the summer of 1980. By 1985, over 100 obstructive sleep apnea patients were being successfully managed with home CPAP therapies. And during the 1990s, developments in CPAP masks increased comfort and usability, allowing it to be used by many more patients. Today, there are literally millions of CPAP users in the United States alone, and a lot more worldwide. However, it is estimated that about 50% of patients recommended for therapy are non-compliant. Although the effectiveness of CPAP therapy increases as it is used longer than the recommended 4 hours per night, less than half of people with obstructive sleep apnea adhere to using their CPAP for as long, as OSA patients tend to be older, possibly with other pre-existing comorbid medical conditions, which may intercept their usage, or other factors that may intercept their usage. Good CPAP compliance is used greater than 4 hours per night, which is considered acceptable to achieve clinical improvements in patients with obstructive sleep apnea.
Essentially, our next problem is sleep quality. Behavioral change techniques differ for sleep purported health apps because sleep is not always under the individual's control. It's both voluntary and involuntary. To hopefully change behaviors towards sleep, actions must be taken for the predicators of sleep rather than the consequences or outcomes. According to Arroyo and Zadowski, Data collected from previous nights will serve as a trend and can provide users with sleep pattern trend associated and help them identify associated behaviors that led to nights of better sleep quality. Essentially, letting users see where they can improve, what worked and what did not work. Utilizing MHealth application will also assist users in delivering the different motivational and behavioral techniques to patients digitally. This can be more convenient as well as more cost-effective for both practitioners and patients. This will provide guidance digitally, can also provide opportunities for more uncommon techniques such as music therapy and assist with calming.
The proposed MHealth app for OSA patients using CPAPs will be designed as a native app to provide better performance and optimization for the app on the user's mobile OS, and it's also user-friendly. Key intervention targets for the application are to improve the user's self-efficacy, health literacy, and knowledge. It would also support connection with two of the most popular Bluetooth-enabled CPAP devices, the Philips DreamStation 2 and the ResMed AirSense 11. And this will assist with logging CPAP use and create adherence goals. This can help users increase CPAP adherence by using motivation and to help assist with behavior change. The app will also be able to log sleep quality and convert data to a graph to help users make connections with how CPAP use, sleep hygiene techniques, and what time to go to sleep can affect their quality of sleep and help them make more healthy choices concerning their sleep. Connection to the phone's movement, microphone, and health data, as well as smartwatches, will lead to the ability to log other sleep quality measures such as snoring events, sleep patterns or restlessness, and blood oxygen levels while sleeping. To help increase health literacy and knowledge, there will be educational functionalities such as video and guides with images for CPAP help and guided oropharyngeal exercise therapy, which has been shown to increase CPAP adherence and reduce the severity of mild to moderate OSA. Sleep hygiene tips and relaxation techniques will also be available for the user that will help improve pre-bedtime rituals. Relaxation techniques include guided meditation and music therapy or music sleep aids, such as white noise or calming soundscapes. Another important function is the ability to enable easy communication between the user and their providers, so they will be able to conveniently ask questions and send CPAP log data to their provider. The app that sprang from those ideas is SuyaSuya. The term comes from the Japanese onomatopoeia SuyaSuya, a kind of mimetic term for someone sleeping peacefully. The design of the app will utilize a pleasing color scheme, easily readable fonts, and simple layouts that will help users enjoy using the app and increase usability. In Figure 1, we see the initial login or title screen. Users will log in using their password, PIN, or biometrics such as fingerprint or Face ID. The users will stay logged in unless they choose to log out by pressing the logout button in the main screen. By having the user continuously logged in, the user workflow will be more streamlined and the user can go straight into the core features and functionalities without the frustration of logging in when they want to utilize the app. If the user wishes to log out, the user flow will also be assisted with the convenience of using biometrics for logging in. Figure 2 is the main screen. The menu access will be on the top left for access to settings, information about security, account information, and alternate access to the different functions and direct access to functions such as the sleep exercises, meditation, and CPAP directions for convenience. The menu screen, like the rest of the app, will have clear large buttons to access different functions. Daily before sleep, users can click the button to go into the before sleep screen. The 4 functions of this screen are apply CPAP, sleep exercises, wind down, and set reminders. Apply CPAP will show the screen represented by Figure 4 on the next slide. Sleep exercises will contain video guides of oropharyngeal exercises. Wind down will have information and tips about proper sleep hygiene and the option to use guided meditation to assist with sleep and anxiety with additional relaxation functions such as calming audio or relaxing sounds. With set reminders, the user can set notification reminders or alarms to begin to get ready for bedtime and will serve as a reminder to go into the app. And then from the top button on figure 3 brings us to the Apply CPAP screen. This Apply CPAP screen will have videos for CPAP and mask use, as well as CPAP directions with images to help guide the user in proper mask placement and CPAP use. When the users wake up, the users will use the After Sleep screen shown in figure 5. Questions on sleep quality will be asked, such as their tiredness after they felt after they slept, if they used their CPAP machine, and for how long they used the machine during the night. Sample Likert scale questions will be shown in later slides. Users can also manually enter their sleep hours. In figure 6, sleep logs will bring the user to a visual representation of the information logged from the before and after sleep functions. They are able to see sleep hours and sleep quality, such as the restlessness during the night, as well as different buttons to toggle the graph information to show CPAP usage. There's also a button below the graph to change the date range to show information over varying lengths of time, from weeks, months, to years, depending on how much the user has used the app. This can help users see sleep progress and make connections on how different behaviors and sleep actions can affect sleep quality. The Sleep Goals button on the bottom of the screen will take you to Figure 7, the Sleep Goal screen. This will show auto-generated goals, such as using the app or CPAP for a certain amount of days, and users can set up their own personalized goals as well. This screen will show their achievements and progress on goals and help motivate users towards adherence. Users can be further encouraged by seeing their completed goals when they click on the bottom right, More Completed Goals. They can see how many little stars they've collected. In Figure 8 is the Provider Connect screen. This will allow the users the ability to send messages of any questions they have to their providers, as well as send their log data. If the user receives a new message from their provider, the button on the main screen will have a new message icon next to it. A notification will also show for the user on their phone when they are not in the app. From that last button on the main screen, the CPAP Help will bring the user to the same CPAP information screen seen in the Before Sleep screen. This will allow fast access to information for the user concerning their CPAP.
Okay, so our target audience for our SuyaSuya app intervention is targeted for people with obstructive sleep apnea. This condition is more prevalent in men than in women and increases with age, and as well as when obesity occurs. About 1 billion adults is known to suffer from this condition from ages 30 to 69 worldwide. As it is a little more prevalent in older population, our app seeks to be more appealing, as well as visually appealing to the older population with a little less technological literacy, as well as we target people who are suggested by providers, clinicians, nursing homes, anybody that would like to improve their condition, and people who have trouble adhering to their CPAP machines. Our study design, we will be using a randomized controlled trial. Again, participants for the study would be recruited mainly from sleep clinics, nursing homes, or patients suggested by physicians. A randomized controlled trial is useful as it can increase confidence in finding results and evaluate the clinical effectiveness of an MHealth intervention, with the control group being CPAP users that do not use the app. Because it removes selection bias and decreases confounding, a randomized control trial is beneficial for establishing causal links between the intervention and outcomes. The changes noted between the intervention and control group can be more likely due to the intervention of the SuyaSuya app and not to other variables. We would be using Nielsen and Laudier's mathematical formula found here on the slide, which can reveal up to 80% of usability problems. So when the participants are recruited for the study, they're categorized into 4 profiles: regular adherence, non-regular adherence, persistent non-adherence, and non-persistent non-adherence. This is done through predeterminants that place, and then they get placed into the study accordingly. These groups are differentiated by the duration and regularity of CPAP usage. Due to the study being a field study, as it is being done in their own space and time, this categorization would enlighten developers on habit association and how the features would encourage engagement. Again, these are placed by predeterminants. This can also help developer team analyze usage of low persistent users, and over the duration of the study can determine where attrition may occur. And we would always need proof of adherence. This is measured by logging into the app and keeping data on the duration of CPAP usage. Our usability testing would again facilitate field studies to represent the participants using the product in real time while completing tasks in their own space and time, as CPAP usage would mainly be at night before sleep, by their own selves without any help. This would also provide that comfortability and also provide in-depth feedback by lessening bias as opposed to a moderated usability study. We'd also employ a Likert scale, which would be using questionnaires that would pertain to sleep quality, visualizations, as well as the main point, the CPAP adherence. An example of that would be a question like, how often was your mask removed? Anything of that sense. This would give a sense of behaviors and behavioral change over time, as well as the app would include a feature of oropharyngeal exercises, which are exercises that significantly cut snoring. They would push the tip of their tongue against a hard palate and slide their tongue backwards around 20 times. They would suck the entire tongue up against the palate 20 times, force back of tongue against the floor of the mouth while touching tip of tongue to bottom incisors about 20 times. So there would be step-by-step video guides available if suggested by their providers, and the app would test the effectiveness of these exercises. The outcomes that we are interested with the implementation of this intervention would be for, of course, OSA patients to engage in CPAP usage, again, encouraged by our app. Our primary outcomes we would be looking at would be the effect on various factors such as daily CPAP usage, sleep quality, their symptom severity, as well as oropharyngeal exercise effectiveness. A secondary outcome that may present itself would be mental health as well as behavioral outcomes. For example, the quality of life for those with OSA may increase with a possible reduction in the symptoms of OSA while using the app. These include anxiety, excessive tiredness, morning headaches, memory loss, as well as mood swings.
So on this slide, this is our discussion application page. Ultimately, not all CPAP machines have Bluetooth connectivity. It may be difficult to retrofit older machines with Bluetooth via a dongle. This would limit the total user install base of the MHealth intervention, as well as presenting a significant engineering challenge. Next, it may be difficult to ensure application compatibility with machines that do have Bluetooth connectivity. Some manufacturers have proprietary applications that display sleep data. Ensuring application compatibility may require reaching out to manufacturers. We suspect this application can be used for people with sleep quality issues because we have information on sleep hygiene that may help the general public that's not really using a CPAP machine. And in the end, we hope to include more health literacy components. Future builds may include those. Anyway, thank you.